Hello and welcome to the pod. I'm Nathan Fink.
I'm Jolyn Drennan, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the show, I'm joined by Becky Berk, data manager at the Children's Trust. We talk essential questions, and later, I'm joined by Geraldo Pilarski, administrator at the Division for Children, Youth, and Families. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. Today in the show, we have a special guest, Becky Berk, data manager at the New Hampshire Children's Trust, who, might I add, is captaining our fabulous family support data system. And I have a boatload of questions. Becky, thanks for coming on.
You're very welcome. Thank you.
A few weeks ago, Jolyn and I talked about the family support data system and what it can tell us. And I was curious, how does one even approach building a data system of that magnitude?
So when you start building a data system, it's really important to build it for the people who are going to be using it, right? So there's a tremendous amount of conversation with the family resource centers and with the state agencies who are also interested in partnering with us. And whenever you're putting something like this together, you're always building toward the essential questions that you want to be able to answer at the end. So it's like a logic model for those people who are used to writing grants or for doing this kind of work. You start with the so what question, what you want to be true at the end, and then you backwards plan, and then you build forward. So there's a lot of that iterative cyclical work that goes into building this so that we can collect the data in a way that is efficient for staff, or as efficient as we can make it for staff, and also gets us the information that we need to be able to advocate for the really critical work that family resource centers do around the state.
And I'm hearing a lot of things in there. I'm hearing efficiency is a factor.
It's absolutely a factor.
And then I'm hearing your essential questions and what you would like to be true, which does kind of scare me because at the outset, if you're proposing a theoretical question, but then you haven't kind of the implication that you're leaning towards a truth in that question, isn't that provincial in what might rise to the surface in terms of, say, the exclusion of other important questions?
So I think that you misunderstood my point a little bit. Essential questions are not cast in stone. They are not the be all end all, but they are the beginning questions of things that you are curious to know.
What makes for a good essential question to be the seed of a data system?
Essential questions vary a little bit program by program, but overall, in general, essential questions might be things like, if we look at the families who were referred to our family resource center and the families who actually decided to enroll in programming here, what does that look like? And the families who chose not to enroll, why not? Why aren't they enrolling? Is it something that we're doing or not doing that might be making this place seem a little less friendly? Is it a transportation issue? Or another essential question might be, geez, if we look at the families that we're serving a tremendous percentage of our families are from this one town, but we hardly see anybody from this neighboring town. Why is that? What else might we do? Should we do some outreach there? What are the best outreach functions, right? So essentially the data is a way to explore not only the what is happening question, but also the what is not happening question, and creating some curiosity around that.
Yeah. I think I just thought of a new game called Essential Questions with Becky Berk.
Okay.
I have a couple essential questions of my own, and I want you to tell me how I might be able to shape it as a seed for a data system. You ready to play?
Sure. Great.
Okay. So how do I get my son to wear pants outside? Is there an essential question there?
So I would say the essential question behind your predicament is, under what circumstances is your son more or less likely to be amenable to wearing pants outside? Under what conditions? Is it weather related? Is it time of day related? Is it tone of voice of dad related? What kinds of elements might go into his decision making, whether he's conscious of that decision making or not, right?
Okay, so I'm going to begrudgingly give you a point on that one. So second question is, are these supposed to be skinny jeans or is it just me?
Not sure I understand the question.
I'm going to give myself a point on that one. Final question. Where did my wife leave her cell phone again?
So this might mean going back into your historical data and looking for trends. So based on previous situations and the information and data that you have gathered around prior circumstances where your wife has misplaced her cell phone, what are the most common places when that happens? And again, is there a certain time of day when she misplaces her phone, and where might she most likely be during those times of day?
Oh my gosh, I think you just, I think we have a winner. How does a data system then remain fluid and responsive?
Well, that's the $64,000 question, right? So because the family support data system is really designed to capture a huge amount of data, a huge range of data, but the amount of data actually required varies so much, we've built it so that the number of required fields by the system is very low. There's a very low bar to be able to save a record, right? The only thing you need for a person is first name, last name, of date of birth. And even the date of birth can be approximated, right? If you're not sure. But then being very clear around what program or what programming is this family enrolled in and what data is required by that family to answer that program's essential questions, which may be different from the essential questions from a different program. So essentially, it's a series of maps through the data system so that whenever a person is working with a family, depending on what program that family is enrolled in or that person is enrolled in, they can follow a map and know what kinds of data fields they should be intentionally asking and recording.
Got you. Now, is there also a trick to a data system remaining human? Because sometimes we're looking at, a series of what feels like ones and zeros, and there's humanity behind that.
Because these are family resource centers, the relationship with families is paramount. And so we never want families to feel like they're going into a doctor's office and having a series of questions rattled off at them. It's through conversation and through relationship building that some of this information is gathered anyway, right? So the relationship is key, and it's not a fill in the blank form. And then in terms of keeping the data real, so you're right that data from a data system can tell you only so much. And it can give you stats, it can give you numbers, it can give you percentages. But keep in mind also, the data system provides quantitative data. There's a whole nother element of data called qualitative data, and that's the storytelling. So in order to really get an accurate picture, you do need both. You need the numbers to be able to answer some essential questions and to give you curiosity about what those numbers mean. But then you need the stories, because the stories tell you some of the information behind the numbers.
That's amazing. Thank you so much, Becky, for coming back on. I always appreciate our conversations around data and how human they seem. So please join us again when you have a chance.
Great. Thank you so much.
And when we come back, I'll be joined by Geraldo Pilarski, Administrator at the Division of Child, Youth, and Families. Don't go anywhere. This podcast was brought to you by Nixon Peabody, who delivers exceptional legal services for clients in the community by combining high performance, an entrepreneurial spirit, deep engagement, and an unwavering commitment to a culture of collaboration, diversity, and humanity. Nixon Peabody works with universities, hospitals, and nonprofits of every size to maximize impact. For more information, visit nixonpeabody.com. Today's show was also brought to you by the Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy and Protection Program, a multidisciplinary program with the Children's Hospital established to evaluate and provide integrative care to suspected victims of child maltreatment. Together, a team of physicians, advanced practice registered nurses, social workers, nurses, and child life specialists work to provide consultation and evaluations of children who are suspected victims of abuse, so to serve in the best interest of children and families at multiple levels of prevention. For more information about Children's Hospital at Dartmouth-Hitchcock and the Child Advocacy Protection Program, visit www.chadkids.org/child-advocacy. I'm thrilled to welcome Geraldo Pilarski, Administrator at the Department of Health and Human Services.
Yeah, no, thanks for thinking of us and including us in this conversation.
How would you describe your role within the Department of Health and Human Services?
Really, my role is to design interventions, programs, and support the field. The unique dimension and area of capacity building that I am responsible for and really have taken the lead in the state for the last 10 years is actually what we call family voice, or really looking to build our division's capacity to leverage people with lived experience. This would be former clients of ours to be identified, recruited, trained, and deployed as partners with the CYF, as parent leaders, as consultants, as advisors, as training partners, and also as staff providing peer support to families that are now new to the system. So that's perhaps it's unknown. It's a little bit of a secret of the CYF. I think a lot of people don't know how much our division and our department has invested on that and how much we have really worked for the last 10 years. And I'm telling you, we have developed different methodologies. We have had about 800 caregivers that have become involved as leaders throughout the state. And as you know, this is very fluid. Leaders, they come and go. And so we're constantly engaging the field in identifying parents that the cases are getting closed to sort of be recommended to the program. So harnessing that voice and engaging parents and kind of establishing them as leaders within the division so they can be agents of transformation, systems transformation. That's essentially kind of what I do. And then I support the field in so many ways, like the staff development. We run workshops. So just imagine inviting the CYF newly hired staff for a 2 days experiential learning where you have 12 staff and 12 parents that have lived the experience, have had child removed, have had us in their homes assessing for safety, had to reunify. Some of them actually lost parental rights. So you bring a group of those folks, you create a safe space, and then you facilitate these powerful dialogues. And it's a curriculum. And what that does is you are really helping the workforce of the CYF to start their careers really grounded on the realities of families, because they're listening directly from the people that have gone through what it's like to be involved with the CYF. So that's just one way that we support like workforce development. Then we also have what we call family engagement and family empowerment action teams. We call them Better Together teams for short. And that's kind of reflecting our strong philosophy of partnership and promoting partnership. Nathan, I think you know within the CYF and the community, there's a lot of fears and mistrust. And so we work to really understand that as division. And then really at the ground level, engage the field and empower the field, the staff to be thinking about practices that can really help families and be more engaging and help alleviate some of the stress that we bring in when we go to a family. I mean, like I've heard 800 families, their stories, and it really, you can see the themes kind of coming through and the need for us to transform the way we work with families.
What are some of the themes, the learnings, the practices that are coming out of engaging with parents who have been through that system?
Yes. So I mentioned the Strength to Succeed. This is a peer-to-peer support model that came completely out of this kind of 10-year process of us listening to families. When they described their involvement with the CYF, they really pointed to that fear and a lot of stress, especially in the very beginning when they get petrified and they have lost their kids or they are afraid of losing their kids. And so we have been asking them, okay, what would make it better? What would be helpful to you? And families have pointed to saying, if there was someone that I could trust that could help me, and get grounded, understand kind of the importance of the threats, the safety of my child, and understand also that the division is actually here to help me and support me. What would that person look like? And so we went into a process and we really came to the conclusion. I mean, the parents really strongly said, if there was another parent, someone that I can really trust. And so we built the model around that. So that's one example. The other one is there is a lot of mistrust between birth parents and the foster parents. Foster parents are those that temporarily will take care of the kids. So they're part of our safety plan. If we go in, assess safety and risk, and we understand that a child is in grave danger, the parents just don't have the protective capacity, as we say it. We may need another adult that can step in and be the caregiver. Those are called foster parents. So birth parents and foster parents, there is a lot of mistrust. And so we have been doing workshops, bringing in birth parents and foster parents and say, let's talk about that. What would a trusting relationship look like? And what is it that needs to happen? And they said from the very beginning, when there's a placement, the division needs to facilitate a meeting between us, that it's not about the case plan or anything, but it's about us connecting as parents. And foster parents said, I want to be able to tell the mom, I'm not here to take your kid away. I'm so honored to be the person that can care for your kid, but I want to work with you. And the goal is that, little John needs to go home. So these were profound things. And we actually created a family team meeting model now where sort of the icebreaker meeting that the parents suggested, it's been incorporated. So these are just two examples. We have had parents directly serving as practice advisors to field staff on how do you safety plan with a family when substance abuse is present. And so these are parents that were there. They had substance abuse. We conducted the assessment. We asked them, how was that assessing for safety conducted? What was the safety plan that we put in place? Did it really work? And parents are very candid saying, no, that really wasn't strong enough. Or here is one thing that you guys really missed it. And this is helping staff then understand what is it that we're not really aware. And we know just a tiny bit of the life of families.
Yeah, it seems like there's been a concerted effort to reassess New Hampshire's child welfare system in the last few years. And you're going back a decade to say, system has gone through a transformation. What prompted the state to look at the system itself and reassess and transform that system?
So we have within the CWF, we have internal processes to conduct reviews. They're called case practice reviews. And every state also is part of the federal child welfare system, right? And so there is a federal review, Child and Family Services reviews. And so those are two important sources of kind of data and us looking at outcomes and saying, are we doing the very best that we can for our children and our families? And it was very clear that we were not, that there were things that really, that we could do better. And how can we really understand that? And so 10 years ago, we started we call the Parent Partner Program. And this was just this vision that we would be inviting families. And it wasn't something that staff initially embraced. When this idea was proposed as part of our developing a practice model for the division, staff reacted, and staff were concerned that this would maybe re-traumatize families, and there isn't a family that would want to do this. And, and there were all kinds of reasons why staff felt that developing a program like this would just be a lot of investing and it wouldn't really help us understand anything new. That was then 10 years ago. And so what we did, because of all the resistance, we did something really wise, which was to conduct an agency readiness assessment. And what this means is not just conducting that classic kind of on the surface, something that people think the director wants, and then everybody says, oh, yes, 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 yes. But being able to do a deeper dive and really understand what were those fears, created that safe space. I so have worked for the last 10 years on building safe spaces for people to have those challenging conversations, to be able to feel safe to say, this is what this feels for me. And this is on both sides, the families as well as the staff. DCOF staff is so stressed because we're working with families that have challenges and are vulnerable, and children that are in danger many times. And really working with families and making those challenging decisions, whether to remove a child you don't want to remove if there's no need, right? Because that creates a lot of trauma for children. But also you don't want to leave a child in an unsafe situation and something can happen. So think of all those fear stressors and all of that. The agency readiness really helped us understand the staff's concerns and gave us a ton of information on how to design the parent partner program as a long-term strategy that would be sort of a working on the culture shift and bringing in parents and supporting parents and building a budget, creating a way to compensate. Staff were like, I don't want you, Geraldo, inviting my parents to be volunteers for you. I know they are vulnerable families, moms and dads, they may come, but they are losing work time and this is going to undermine families. And I was like, that's golden. We need to build in a way to compensate. And so we do. Any activity that I have and I bring in parents, we have a system where parents are compensated. And it starts at $30 an hour because we really believe in providing people a fair compensation. So that's just it's just what kind of precipitated, and it was our desire to then really understand the realities of families, understand our interventions, understand their fears, and really begin to say, so what can we do differently to make it better? And as we started doing that, people that initially were resisting for all kinds of reasons, right? Now they're beginning to see how this can actually be structured in a way that is respectful, that really brings in value, and we articulate what that added value was. And we build those safe spaces and staff start having those experiences where they were like, I'm never going to approach a removal the same way. I'm never going to do this in the same way. And this is the way I'm going to now approach families. And so it's been an incredibly driver for transformation and change from the grounds up, where you're empowering the staff at the ground level to meet families, have those conversations, come up with an idea of a change in practice that they want to implement. And I can give you an example. When 10 years ago, when we removed a child, the thinking was we need to really establish some routine with the child and the foster parents. And so we're going to wait about 6 weeks or so to then set up a visit. Seeing parents is just going to be re-traumatizing, confusing, and kids need some time to settle in. That was the wrong thinking about attachment, and all of that is like such a misunderstanding. I remember being in a meeting with parents and I look at a mom and I said, so what happened when your kids were removed? And the mom started to cry. This can be very emotional moments. That's why you need safety. You need people with skills to facilitate these kinds of conversations, right? And the mom started to cry and she said, I went on a binge day after day. And she proceeded to talk about the pain and how the only way she could manage that was the way she knew, which was to, get intoxicated and continue to drink and all of that. And so I look at her and I ask, what could we have done? See, I'm a social worker, right? I'm here to protect children, to help parents find healing and empower parents, right? So I'm like confused. I'm like, okay, we're causing something that it's absolutely not what we want, right? What can we do differently? And the mother was very clear. It was, if I could see my kids the next day, probably then I wouldn't go out and be on a bench. And we were like, wow, this doesn't take $1 million to implement. So I look at the staff and I said, let's test this. And I was at the time the supervisor in Nashville. So I was overseeing that district office, 60-some staff, doing the PDSA Plan, Do, Study, Act, which is a method that empowers people at the ground level to test small change in practice. So we brought in the resource worker. This is the person that works in the district office with foster parents. We brought her in to the team and we're talking, and she's like, oh, I can coordinate that. If I'm finding a foster parent for little Johnny, I'm going to say, and tomorrow you bring little Johnny to the district office to meet the parents, and you also will be meeting the parents. Think about that, right? And staff were like petrified, saying, Geraldo, this is not going to go well. You will see, right? So we tested it. I remember there was this little toddler. She was like 3 or 4. Next day, mom is there, dad is there, and the little girl and the foster parents. And things went well as far as the parents having some time with the child was supervised. But when it came time for the child to go home, she literally grabbed the mom and she's crying. And the staff were like, Gerald, that's why we don't want to do these things. And I said, oh, no. I said, that's a very normal behavior. Think about it. This is a little child, right? As a toddler, she sees mom, her world. Of course, she's not doing anything. I said, if she didn't cry at all, I would be worried. Look at the attachment with mom. Think about that. How can we nurture that, continue to protect that? How about tomorrow, another visit? But we started doing it. And you know what? A few days later, it's fascinating when you facilitate and create a safe space for adults that are caring for a child to connect. Now the child is feeling safe. She's seeing the caring adults connecting, and she's feeling better. And so, a few days later, now it's time to go home. And I remember she just let go of mom's hand and went with the foster mom. No more crying. So we started doing that, and we just testing, refining the process and all of that. And then a few months later, like 3 months later, staff are coming to me and saying, I wanted that for my kids, Geraldo, if I'm removing or whatnot. So that's an example of the power of harnessing, like really being able to listen, understand the experience of a parent, and then say, what is it that we can do differently?
Yeah, that's an incredibly powerful story of identification and empowerment of both the parents and the worker who's on that job. It's empowering both of these parties to participate. How does the data, or what data might follow that anecdote in terms of demonstrating its positive impact or outcome?
So the research is extremely clear about this. When you have the two adults that are caring for a child that really connect, and this is true also for mom and dad when they don't live in the same household, if they partner and really co-parent in a way that is empowering the child, the well-being indicators of that child just go off the chart, right? And the opposite is true too. If there's tension there, children pick up on that. And this is when their well-being gets undermined. So we also know that when foster parents and birth parents are really connecting right away, not only this really helps the well-being of the child, which is one of the core missions of the division. So now the child is safe, but it's also thriving. The other outcome that we see consistently is that children go home faster because now parents are motivated. They're seeing their kids. Instead of going on that bench, they are now beginning to work with the team, and we can build a strong team around them.
With regards to the division then, DCYF, what is their overall vision given this transformation?
Yeah, so the vision for transformation is one where children are safe and families are thriving. And so how do you bring that vision to life? So the piece of this that I bring in is to say we cannot build that new system, new service array and all of that without having people with lived experience at the table. Their expertise is so unique, and they're going to be partnering with us. As DCYF, we've been working on that. There is one area of the entire system that is now gaining a lot of attention, and that is the prevention. And I'm sure your agency really has done tons of work on that for years and years, for decades, right? And so you know that preventing child abuse and neglect, preventing maltreatment is the best for kids, right? And so our division now is working on that. The entire child welfare system is working on it. So that's one dimension of transformation. And what does it mean to build capacity for prevention within like the state of New Hampshire? Part of that is creating what we're calling parent empowerment models, where we're able to really engage parents in a positive way, that their experiences of systems changes. And part of that is breaking down the silos and getting like the entire department to start working, understanding social determinants of health, and really recognizing that families have challenges and that we need to create resources, provide resources, and bring in those resources. So housing stability, employment, food, and all those pieces, families are able to provide. Engaging our colleagues throughout the department and our community partners. And that's been really a wonderful piece of our whole transformation process, and understanding the division, the child protection part, as just one dimension of a continuum, right? The other piece is building then a service array, because you don't want to just talk about prevention. You really want to have a service array that then will support that. And so our division now is able to redirect some of the federal funds that come to the state of New Hampshire that were traditionally used for child protective traditional services. Now we're able to repurpose some of that funding, take some of that funding, and build service array. And we've been working on that, and it's a wonderful development that is going to really help families. So just imagine the mom that I was talking about that got some support and then became a leader with us. But just imagine when life began to be hard and she had hardships, if there was a community-based voluntary services where the first time we knock at the door, and sometimes we go in and we assess for safety, and there isn't enough evidence and the courts wouldn't support removal, and we know children belong with parents, but we didn't have a mechanism to really bring in some supportive services or connect the parent to resources up to now.
Yeah, that's incredible. Connecting people to the supports that are there in the community so to prevent removal from the first place. That's a wonderful vision, wonderful mission. I am thrilled that you took the time to speak with us today. Thank you so much for joining us.
Anytime. Absolutely.
Many thanks to New Hampshire's Office of Social and Emotional Wellness for sponsoring this podcast. Started within New Hampshire's Department of Education, the Office of Social and Emotional Wellness consolidates policy development and implements projects and programs that are focused on health and wellness with an emphasis on behavioral health of all students, youth, and families. To learn more about the Department of Education and its many programs and approaches, visit www.education.nh.gov. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.